Hi, my name is Chelsea. I'm a nurse practitioner student and I'm going to be assisting with you today. I'm going to perform some hand hygiene. Can you tell me your first and last name?
My name is Brandon O'Hanlon.
And what's your date of birth?
It's August 30th, 1981.
Awesome. And can you tell me the year?
It is 2025.
Awesome. And how did you get here today?
I drove.
Awesome. And what brought you in today?
I have left knee pain.
Okay. So we'll definitely assess that. I'm going to do a head to toe assessment. So first I'm going to look at your head. So your head size and contour appears to be normal. Can I have you frown and puff out your cheeks? Wonderful. And that tells me cranial nerve 7 is intact. And then I'm going to take a listen to your temporal artery here. Awesome. Then I'm going to assess your scalp here. And I don't see any hair lesions. The texture and distribution appears to be normal. I don't see any patterns of loss. So next we're going to do the range of motion of your neck. Can you look all the way to your one side? Good. And the other side. Down. And all the way up. Wonderful. Now I'm going to feel your lymph nodes. So we have your preauricular, your occipital, your tonsillar, your submandibular, your submental, your superficial cervical, your posterior cervical, your deep cervical chain, and your subclavicular all appear normal. There's no deviation for your trachea. Can I have you swallow, please? Awesome. So thyroid gland appears normal with rest and swallow. Now I'm going to look at your eyes, eyelids, eyelashes, palpebral fissures all appear normal. Eyebrows are in line with each other. Your conjunctiva, sclera, cornea, lens, and pupils appear normal. And now I'm going to check your visual acuity. So I'm going to have you stand up and look at the chart over here. Just go ahead and stand right back here. And then read the lowest line that you can.
FELOPZD.
Wonderful. You can have a seat again. So patient has 20/20 vision. And now I'm going to do what's called cover uncover test. So if I could have you look at that phone over there, that would be wonderful. And just keep looking at it. All right. Have no deviation, no strabismus on both sides. Wonderful. And then I'm going to shine a light here inside your eyes. Just keep looking straight ahead. And eyes are equal and really active to light. The pupils are. All right. And then now I'm going to have you look right at my nose. And I'm just going to check out your peripheral vision. Can you see my fingers here? 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 Wonderful. Okay, and then now I'm going to look into your eyes. Wonderful. Perfect. Okay, and on the other side, and I see a normal red reflex, optic disc, and retina. Okay, wonderful, and I do see that corneal reflex as well. Okay, and now I want you to face with me and just follow your eyes with my finger. All right, wonderful. And so all 6 cardinal fields are within normal limits. Now I'm going to check out your ears. I'm going to look at your auricles on both sides, and your ear canal on the right side appears normal. I'm going to have a look inside your ear. And I can visualize the eardrum, which appears to be within normal limits. On the other side, same thing. Auricles appear normal, and the drum is visualized, and everything appears within normal limits there. And then we're going to do a whisper test. So I just want you to repeat back to me what I say.
A, B, C. 1, 2, 3.
Wonderful. And now I'm going to make a noise with this machine, and you're going to tell me if you hear it more on the left side, the right side, or the same.
The same.
Awesome. And then I want you to let me know when you stop hearing the noise.
Okay, I stopped.
And can you hear this?
Yep.
Okay. Same thing.
I stopped hearing it. Yep, I can hear it.
Awesome. This is a normal Rennie and Weber test. And so now I'm going to fill your face here. And so I see normal frontal and maxillary sinuses, and I'm going to take a look at your inside your nose here. And the nostrils appear patent and within normal limits. And then I'm going to test your cranial nerve 1, which is your sense of smell. So if you tell me what this smell is.
It's cherry.
Perfect. Now I'm going to inspect your lips. They appear normally moisturized. I don't see any lumps, lesions, ulcers. I don't see any cracking or scales. And then can you open up your mouth for me? Beautiful. I'm going to turn on this light, just get a better visual. Wonderful. And the oral mucosa looks normal. Teeth, gums appear normal. Can you put your tongue to the roof of your mouth, please? Wonderful. Stick your tongue out all the way and say, ah. Beautiful. We have a normal uvular movement. I can see both tonsils. I can see the soft and hard palate, the anterior and posterior pillars. They all appear normal. Go ahead and stick your tongue to the side of your cheek on the inside. Push against me. Push against me. Wonderful. And that is normal. Okay. And then can you swallow for me? All right. Swallow appears normal. And then go ahead and move your jaw forward and back for me, and side to side. And I don't feel any clicking or crepitus or anything indicative of TMJ. And then now I'm going to look at the rate and rhythm of your breathing. Breathing appears normal. It looks like you have a rate of 18, which is also normal. I don't see any use of accessory muscles. The shape and diameter of your chest appears normal as well. And do you have any tenderness at all? Okay. And then I want you to say 99 every time I touch your change hand positions.
99, 99, 99, 99. 99, 99, 99, 99, 99.
All right, tactile firmness appears normal. And then go ahead and breathe in for me. And breathe out. And lung expansion is also equal and normal. There's no excess exertion. So now I'm going to, while I'm back here, percuss your back lung sounds. You can look here to touch. Okay, wonderful. Next I'm going to listen to your lung sounds here. All right, breathe in now for me. Okay, again. 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 breathe in and out for me? Again. 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 Okay. Lungs are clear in all fields. Now I'm going to listen again, but each time I move my stethoscope, I want you to say E. Okay, go ahead.
E, 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 E.
Okay, perfect. And so the egophony is normal. I'm hearing E. I'm not hearing it translated to any A sounds. So now I'm going to have you lay down with your head at a nice 30-degree angle. Wonderful. And I'm going to feel your carotid pulse. Wonderful. You have a nice strong pulse. And I'm going to feel for your jugular vein. And carotid pulse. And jugular vein. And now I'm going to have a listen. That all sounds normal. And then I'm going to palpate your cordium and tell me if there's any tenderness here.
No.
I don't feel any crepitus or thrills. And then I'm going to palpate your PMI at the fifth intercostal space. And then now I'm going to listen to your heart. And we have your aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral. And all of those sound normal. And then I'm going to check your heart rate and rhythm. So you can have your wrist here, wonderful. Okay, and rate, the rhythm is normal, and your rate is 72, which is wonderful. And then I already just assessed this radial pulse. I'm going to assess this brachial pulse here on the left side. And then do this radial pulse. And these are all normal, +2 pulses. Brachial pulse, which is wonderful. Okay, and then now I'm going to check your lymph nodes out here. So here's your epitracheal nodes and your axillary nodes. Same thing here. And none of them feel enlarged. Okay. And then now we're going to do range of motion of your hands and your wrists. So go ahead and sit back up for me. Okay, so now we're going to do range of motion of the hands. So I'm going to have you spread out your fingers, go ahead and bring them in, make a fist, open them up for your wrists, put them all the way down, all the way up, to the sides. Wonderful. We'll do elbows, out, forward, and we'll have you do your wrists up and down. Wonderful. And then with your shoulders, go and put your arms all the way up, all the way down and back, and up, sides, down. Beautiful. And then I'm going to feel your pulses. So first I'm going to feel your femoral pulse, your tibial pulse, or your popliteal pulse, your posterior tibial, and your dorsus pedis. I'm going to do it on the other side. Your femoral, popliteal, your dorsal pedis, and your post-tibial. All are normal. And then I'm going to take a look at your hands. Patient has normal capillary refill. Color is normal. Nails are moist. I don't see any lesions or cracks. The skin is moist. The hair distribution appears normal. I don't see any clubbing or cyanosis on the nails. And then now we're going to move to the abdominal exam. So I'm going to have you lay back down. And then if you can have your knees bent up and your arms at your sides, wonderful. And I'm going to inspect your abdomen. Abdomen appears symmetrical. I don't see any scars or striations or rash or lesions. I see the umbilicus. I don't see any pulsations with that. And now I'm going to listen to all of the quadrants of your stomach. And I hear normal active vowel sounds. And now I'm going to auscultate your vascular sites. So we have your aortic, we have your right renal, your left renal artery, we have your iliac artery, left iliac artery, you have your right femoral artery, and your left femoral artery, and those all sound normal. Okay, and now I'm going to percuss your abdomen. Okay, and that is normal as well. And then next we're going to do the scratch test. And so you're going to feel me scratching very softly on the right side of your abdomen. And there's one border. And there's the other border. So the liver from top to bottom appears to be about 9 centimeters. Okay, and then next I'm going to percuss the liver in size and any splenic dullness. And then I'm also going to palpate the organ borders. And you tell me if you feel any tenderness there.
No.
Okay. A little light palpation and deeper. Okay. And I don't feel anything that would indicate hepatomegaly or splenomegaly, which is good. Okay. And then next I'm going to have you sit back up. Wonderful. And we already checked the CVA for kidney tenderness. So now I'm going to just look at your arms and shoulders and just palpate them, just let me know if you feel any tenderness or anything like that.
No.
Okay, wonderful. And then I want you to raise your shoulders against resistance. Beautiful, that's normal and equal on both sides. Push your chin against the hand, good. Again, down and up, wonderful. And then we're gonna check out your range of motion and muscle strength with your upper extremities. So go ahead and put your arms straight out. Don't let me push them down. Don't let me push them down. Beautiful. Don't let me push them out to the side. Don't let me push them out. Wonderful. And then next, bend your arms like this and pull them in. Wonderful. And push them out. Great. Normal biceps and triceps. and then do your, flip your hands up. Now don't let me push them. Yep, try to rotate them. Very good. And the other way. Wonderful. All right, so normal brachioradialis. And now I want to test your rapid altering movements. I want you to go ahead and move your hands back and forth like this. Wonderful. And then I want you to take your fingers and do some sides. Beautiful. And then if you could close your eyes, and then I'm going to put something in your hand and you just tell me what it is.
It's a pen.
Beautiful. Okay. And now I'm just going to palpate your legs. You know, if you have any tenderness. I do not see any pre-tibial edema on the right side. I don't see any pre-tibial edema on the left side. Toes appear normal color, have normal capillary refill on both sides. And I don't see any lesions on the toenails as well. Wonderful. And now I'm gonna have you do where you take your heel and you slide it up and down your shin, just like that. Beautiful. And then I'm gonna check your patellar reflex, so go ahead and just relax for me. All right, ready, and wonderful, wonderful. That is normal. And so now I'm gonna have you go ahead and lay down for me again. Thank you. Okay, so first we're just going to do range of motion of your hips. So go ahead and rotate, yep, your left hip out and in, and then move, yep,
Oh, sorry.
no, that's okay. And then go ahead and move your hip back, and then all the way out forward, wonderful. And then do the same, yep, out to your right, to your left, up and down. Beautiful, and then we can also see the range of motion with the knees there as well. Then I want to test your strength of your hips, so go ahead and push outward. Wonderful, inward, okay, and pull back. Okay, very normal strength. And then now we're gonna test doing the Lockman's test. We're gonna test if you have any ACL injuries. So go ahead and bring your knee up like this, and I'm gonna place pressure on your femur, and I'm just going to turn your leg outward and inward. Do you feel any pain with that?
No.
Okay. And then next I'm going to do on this side the McMurray test, and just I'm going to take your leg out and in at different angles, and you tell me if you feel any pain.
No pain.
Okay, so now we're going to do it again on this side. Rotate out, in, and any pain there?
No.
Okay, and then same thing.
No pain.
Okay, wonderful. Okay, and then now if I could have you flip over on your stomach, that would be great. Okay, and just relax your feet just like that. Okay. We're going to test your Achilles reflex. Ready? And wonderful. Okay. And then you're going to feel a little tickle on your feet. I'm going to check your Babinski reflex. Great. And those are both normal as well. And so now what we're going to do is called the Apley's test. And so I'm going to have you bend up your left leg for me. Beautiful. And then I'm going to put pressure down and turn your feet, and you just tell me if you feel any pain here.
No.
Okay, and now I'm going to distract and turn. Do you feel any pain there?
No.
Okay, good. And next go up here. Same thing. You put pressure down, and you tell me if you feel any pain.
No.
Okay. No.
No.
Okay. Wonderful. And then you can go ahead and flip back around here. And then go ahead and stay laid down for me. We got one more thing to do. And I'm gonna put your foot up here, and I'm just gonna push down. So here's posterior and anterior fur test. Do you feel any pain with that?
No.
Okay. Same thing up here. Any pain with that? Okay, excellent. Sounds great. Okay, so now we're gonna do a walking thing so you can stand up. And then just walk absolutely normal to the end of the wall. And gait appears normal, general musculature is also normal. And then now I'm gonna want you to walk back to me heel to toe. Wonderful, and that's normal. And then walk back to the wall on your tiptoes. Thank you. And then walk back to me on your heels. And then go ahead and do a knee bend and just squat down for me. Thank you. And that appears normal. And then face this way for me and put your feet all the way together. Wonderful. And then close your eyes. And open them. And I don't see swaying or loss of balance. And then I'm going to assess your spine, so if you could just lean forward for me. That would be wonderful. Thank you. And then go ahead and bend down. And, yep, perfect. And then you can stand back. Can you bend down any further with your spine? Beautiful. And then up. And then keep your hips in line and go ahead and rotate to the right. And then to the left. All right. That completes our exam. Thank you so much, Mr. O'Hanlon.
Thank you.